And staying with the coronavirus pandemic, some health officials are worried about current case levels as we head into the holidays.
New case numbers released by the state today showing more than 21,000 new infections and 95 deaths over the past 3 days. That's averaging out to be about 7,000 new cases a day.
We've also learned that there have been more than 80 new outbreaks at schools in Michigan. Here in Metro Detroit, there were 4 schools in Macomb County, 4 schools in Oakland County, and 3 schools in Wayne County.
All this as Michigan hits a big milestone. 70% of people over the age of 16 have had at least 1 dose of the coronavirus vaccine.
So we're going to bring in our chief health editor, Dr. Partha Nandi, this Monday afternoon. And Dr. Nandi, our health officials concerned the holidays could lead to new hotspots, especially in areas where vaccination rates are low.
So Glenn, listen, a lot of travel, is expected this holiday season. The American Automobile Association says that we're almost back to pre-pandemic levels. The association is estimating 13% increase from last year and predicting that 53.4 million people will travel this Thanksgiving. So this makes me and a lot of others concerned for a few reasons. First of all, there are quite a few people out there who act as if COVID is done and gone. Secondly, case numbers are rising in cold weather states. Michigan's one of them. Over the last 2 weeks, we've had a 33% increase in COVID cases, and our hospitalization rates are also up 20% over the last week. But even states and regions that currently have low case numbers could, in fact, become hotspots, Linda, after Thanksgiving. The virus is super contagious, and there are folks who are resistant to wearing masks, or they're becoming pandemic fatigued. I get it, and now are less inclined to follow the pandemic precautions. So you asked me earlier, are health officials concerned with regions that have low vaccination rates? 100%. The answer is yes. Unfortunately, there are quite a few states that have vaccination rates under 50%. And as one expert puts it, and I agree, these areas are like bonfires waiting to be ignited.
Well, Thanksgiving is typically a holiday spent with family, everyone gathered around the table. Should we invite people if we know they're unvaccinated?
I love Thanksgiving, right? And I know you love it too, but I'm not going to put myself or any of my family members in a risky situation. So if everyone is vaccinated, that's awesome, right? My advice is simple. Your risk overall is low, which means your Thanksgiving could be pretty normal. But if everyone is not vaccinated, right, there are a few questions that you need to ask and think about. Are the unvaccinated family members taking COVID seriously, or do they not even care? Secondly, what's everyone's health status, right? Anyone with underlying medical conditions that could develop severe COVID disease, right? If they're unvaccinated or if they're older. And also, do family members who qualify for the booster, have they received the 3rd dose? So nothing's going to be 100%. Nothing's going to be foolproof here, right? But if you're the person hosting, then you can put boundaries in place. You can request masks, physical distance, and have fans, maybe even windows open if you can, right? You don't be shy about this. You could also ask attendees to get a COVID test if you want. If you're not hosting, then you need to look at your health. Who is attending and decide if you feel if it's safe or not. This is not the time to be, trying to be a nice person and say, I don't care, I'm going to put my health at risk. Remember, the more unvaccinated people who attend, the higher risk. So it's individual, but there are some rules of action that you can really take and say, I'm going to keep myself safe.
Wow, tough calls, but safety calls. Thank you so much, Dr. Nandi.
My pleasure.
And if you have a coronavirus question for the good doctor, you can email him, Dr. Nandi at askdrnandi.com, or you can send it to us on Facebook or Twitter, and we'll get it right to him.